The scapula, or shoulder blade, is a flat, triangular bone located on the back of the rib cage. The scapula, or shoulder blade, is a triangular bone featuring 3 distinct borders and 3 angles. The superior border is the shortest and thinnest, located at the top. The medial, vertebral border runs parallel to the spine, while the lateral, axillary, border is the thickest, extending towards the armpit and housing the glenoid cavity. These borders converge to form 3 angles: the superior angle, where superior and medial borders meet, the inferior angle, where medial and lateral borders meet, serving as a key landmark for scapular movement, and the broad lateral angle which contains the glenoid cavity. The glenoid of the scapula, more precisely called the glenoid cavity or glenoid fossa, is the shallow, pear-shaped articular depression found on the lateral angle of the scapula. It serves as the socket of the shoulder joint, glenohumeral joint, where it articulates with the head of the humerus, upper arm bone. The acromion of the scapula is a large, flattened, and somewhat triangular bony process that forms the highest point of the shoulder. It is a direct continuation of the spine of the scapula, projecting laterally and then curving anteriorly and superiorly to overhang the glenoid cavity. The coracoid process is a prominent, hook-shaped projection on the anterior superior aspect of the scapula. It serves as a vital attachment point for several muscles and ligaments. The supraspinous fossa and infraspinous fossa are 2 distinct depressions on the posterior, dorsal surface of the scapula, shoulder blade. The spine of the scapula, also known as the scapular spine, is a prominent ridge of bone that crosses obliquely along the posterior, back surface of the scapula, shoulder blade. It's a key anatomical landmark with several important functions. The term glenoid tubercle of scapula usually refers to 2 distinct, small bony eminences, or tubercles, located immediately above and below the glenoid cavity on the scapula. These are supraglenoid and infraglenoid tubercle. The neck of the scapula refers to the constricted, slightly narrowed portion of the scapula that connects the glenoid cavity. The suprascapular notch is a distinct, small, and often variably shaped depression found on the superior border of the scapula. The subscapular fossa is a large, concave depression that occupies almost the entire anterior, costal surface of the scapula.